So, welcome to Compassionate Cultures, the podcast where we explore how organizations can create spaces where everybody feels respected, valued, and safe to thrive. So, I'm Rebbecca Hemmings, your host of the Compassionate Cultures podcast and also the founder of Strawberry Words, the founder and CEO of Strawberry Words. Right. So, in this episode, celebrating anti-racism in healthcare, we're highlighting the inspiring work being done to address racial inequalities and build culturally humble, inclusive healthcare systems across Birmingham and beyond. So I'll be speaking to a number of different people, including Olaunde Awe, who's going to be my first guest, the Director of Ilera Health, on improving health outcomes for Black and African Caribbean communities. We'll also hear from Dr Tonye Sikabofori, who is the Deputy Chief Medical Officer and Chair of the Blackshire ICS Task Force. Don't worry, if you don't know what that is, I'll explain. Okay, and we'll also have Dr. Chanel Dennis and Talisa Makita from Melanin Mood CIC to discuss mental health, inclusion, and the power of culturally grounded care. And finally, my colleague Sipo Nglovu from Strawberry Words reflects on delivering cultural humility and safety training and what true anti-racism in healthcare looks like. Okay, so we've got an amazing, I think this is the most guests we've ever had on an episode. So just so you know how it will work, I'll interview each person, we'll do a quick swap over, and then we'll go for it. Okay, so let's go. So Ilera Health is a Black British run organisation dedicated to reducing inequalities among Black and African Caribbean communities in the UK. All right. They've got a great website. Go check it out. So my first question to you, Tunde. The name Ilera is quite distinctive. So what does it mean and why was it chosen to represent the organisation?
Thank you, Rebbecca. Thank you for inviting us. Ilera is actually a Yoruba word. And Yoruba is one of the three major languages in Nigeria. Ilera means well-being. So when we were thinking about the organization, we wanted a name that stands out. We wanted a name that people can relate to. And we wanted to kind of pick on people's curiosity. Because when you say our name is Ilera Health, the logical next thing is, what does that mean?
Yeah, absolutely.
Then we get to tell people about us at their invitation.
Yeah. And what was it that inspired you to create Ilera Health? What personally motivated you to form that vision?
When we first came to England in 2006, we had a lot of experiences. Some we couldn't do anything about. But over the years, as we integrated into the society and learned how to navigate those challenges.
I want to stop you there because I want you to paint the picture. Like, what do you mean challenges? Don't be afraid to go there.
Okay, I'll share some of those experiences with you. When I first came to England, as a matter of fact, I booked my flight to England against an interview. I was a mid-level executive back in Nigeria, and the headhunter said to me, "Oh, this corporation, a very big business in London, they are keen to interview you." And, I said, okay, let's book the flight. I came to England. When can we meet? Silence.
Wow.
Then when I got through to him eventually, they canceled the interview.
Wow.
You should have told me. Okay, what next? Silence. Then I had to start searching for myself. One headhunter, she's South African, shortlisted me for an interview. I didn't know the interviewer. It was the operations director somewhere, and the guy does not know me. And we are going to meet in an hotel. I met this guy. Everything we discussed, simple, straightforward, planned how to start. Said, so what next? Said, I'll get back to you on Monday after speaking with HR director. It's 18 years later. I've not heard from him.
I shouldn't laugh.
Then
Wow.
I spoke with the head hunter. I said, this is what happened. What do you think? She said to me, she recognized my name
Yeah.
as a foreigner.
Wow.
And she knew that they would not give me a chance if she included all my details. So she proposed to the client blind shortlisting.
Right.
They shortlist based only on your experience, but without self-identifying information. And that's how I got on the list.
Wow.
So, and there are so many more experiences like that,
Yeah.
that we think we could help other people overcome and make the experience living in England a better one.
And that's what inspired you to create Ilera Health. Wow. Wow. That's really sad in a way, but great in that you're now specifically helping African and Caribbean communities.
So what was meant to be a stumbling block is more like a stepping stone.
Yes.
And that's what.
Yeah. So let's talk about those stepping stones, because, what is it exactly that Ilera Health does for African and Caribbean communities?
We want to make the society a better place for all of our people. In professional terms, we do market research. We do community engagement. We do training. We do consulting. And I'll share an example with you. Many times you find clients trying to address the problems that breed inequality in society based on guesswork.
Yeah. Okay.
When we come, we try to bring insight. We try to bring evidence, like we are doing with Birmingham City Council now. When we engage, we go in the community to find the issues. We speak with the city council and the stakeholders to find the problem. Then we go in the community, we undertake research.
Yeah. And do you think people are a lot more receptive because of what you look like and your background?
Absolutely.
Yeah. So
when I knock on the door and they see my face, they are more likely to open the door. And that's one of the joy of the work we do, So I just love going out there, seeing people, and then collaborating to make the society a better place.
Yeah, absolutely. So you mentioned you worked on the Cultural Competency Project for Public Health Birmingham, focusing on the Nigerian community. Can you explain more about that? What did it involve, and what were some of the key insights that emerged from the project?
When you live in a society other than where you come from, the odds are that the people will not understand you. And that's okay. But what do we do about it? And that's where we come in. And what we do in our training is we try to break down our culture, our way of life, into bits that are easier for people to absorb and digest, with a view to collaborate better and easier with our people. And I'll share an example with you. When an African woman, a Nigerian woman, is in labor at the hospital, the odds are that the healthcare people attending to her are not responding because they say she's not in pain. She is in pain. That she feels pain differently from the way you do.
She expresses it differently.
Right. Does not mean she's not in pain. Yeah. These are some of the training we bring to people so they can better serve. Yeah. So in our training, for example, we share insight into our culture, why we do what we do, and what those things mean, how we communicate, how we treat time, and all of that, so that when people are faced with a Nigerian patient, for example, the interaction, the service delivery is that much more better.
Yeah, because they have that insight that might mean, whereas I might have made this assumption, actually, I need to make room for what it is I understand about this community. Yeah, I hear that. I hear that. So, unfortunately, I'm going to bring this to an end soon because I've got other people to speak to, but it's so fascinating. There's so many questions, particularly with regards to the training, that I'd love to ask you, but that's for another time. I want to bring this back down to a personal level now, because I'm always conscious of the people, us, on the receiving end of some of these challenges you speak about. So, what advice would you give to African and Caribbean people to help them better take care of their own health?
I think we need to understand the facts, the science, and then make informed decision. Because when we understand the fact, we are more likely to change.
What do you mean?
I was going to use myself as an example. I used to work at Coke. And
the drink? Okay.
And I drank a lot. I think I really drank a lot of Coke. When we got to England, my uncle said to me, "Tunde, you drink too much Coke." I said, "Look, life tastes good with Coke. Going to drink Coke." Then I had an encounter with a doctor who said to me, "Do you realize when you drink a lot of that, you're putting yourself at risk?" And then she explained a lot of the implications to me. The risk when there's a family history based on your diet and all of that. And my wife has been trying to dissuade me from drinking too much Coke. So after that encounter, I was more receptive to what my wife was saying.
She was right.
She was right. And eventually, I stopped drinking Coke. I made changes in my diet. I stopped taking sugar. I substituted cake. I had a lot of cake and chocolate. I substituted cake with fruits.
Yeah.
So understanding the fact helped to make the right choice.
Yeah.
And I believe we can all do that.
Yeah. Ignorance is not bliss. Yeah, I hear you. Thank you. So my final question. Birmingham aspires to be an anti-racist city. From your perspective, working closely with African and Caribbean communities, what would an anti-racist health system or city look like in practice? And where do you think your responsibility lies for making that vision a reality?
I think an anti-racist city is one in which every Black, African, and Caribbean would feel free without any inhibition to go to the point of service delivery and know they will have a very good experience.
Yeah.
Right now, I don't think that is the case. What is our role to make that happen? In the work we do with the City Council as the dependent partner for the community, we will continue to engage to overcome the inertia. Because over the years, there is lack or little or no trust in the city or healthcare service deliveries. So we want that to change.
Yeah.
Build trust. How do you build trust? You build trust by turning up for the community. When we go out to do research and find what needs to happen, we want to be in a position to go back to the community to say, you said the City Council should do that. And they have. So that slowly, with small steps, we are building trust. Training, we want to be able to go to all the people delivering service and train them about our culture, about why our people do what they do, so that they can relate better. Because when you are serving someone you don't understand, the odds are that you don't serve them well.
Yeah.
When you don't serve the people well, the odds are that when they need your service, they are not willing to come. So we want the people to be willing to come. We want to empower the people
Yeah.
delivering service to know that they will deliver the service well. And we want to keep the dialogue going.
Yes.
Because sometimes when you don't discuss what needs to be discussed, that's also exclusion.
Yeah.
That's a choice, and that's not helpful for the city. So we appreciate what the city council is doing already, and I really give them credit for that. We've lived in several parts of the country, because of the nature of the work we do. And I want to say that what we have seen in Birmingham City is quite impressive. So well done, and please keep the good work going. It is possible. We will not give up.
Yeah.
We have to keep at it. And I see a future when Birmingham City can boldly stand in front of everyone out there to say, truly, it is an anti-racist city.
Thank you so much. Please, could you put your hands together for Olaunde Awe? Thank you so much. I just wanted to, there's so many golden nuggets in what was just said. And particularly, I want to pick up on the building trust with various diverse groups. And if you're not aware of it, I implore you to look it up. But the Braving model by Dr. Brené Brown provides a very good model for looking at how you can build trust with communities. So each letter stands for a different element or different way in which you can build trust. So B is for having boundaries, R is for being reliable, A is for being accountable, and so on. But yeah, I thought that came to mind as Tunde was talking about building trust. I know you're enjoying the episode, but I've just got to tell you this. If you're wanting your organisation to transform with regards to diversity and inclusion, you need to check out our Crafting Compassionate Cultures online learning hub. It includes our 4 CPD accredited online courses, including one around anti-racism, microaggressions, sexual harassment, DEI, and more to come. It includes team leader packs so you can have discussions with team members about the learning, our HR integration toolkit so you know exactly how to roll out this program, and it's got email templates and more, certificates of completion, monthly learning reports, a monthly expert-led Q&A, and bite-sized videos, and so much more. Want to find out more and to trial it for 1 day free of charge, no questions asked? Visit our website www.strawberrywords.co.uk. That's strawberrywords.co.uk. Now back to your episode. Welcome. I've been told to call you Tonye, but
Tonye.
I feel like I need to give you a proper introduction. So this is Dr. Tonye Sikabofori. I keep saying Fori, sorry.
Yeah.
Deputy Chief Medical Officer and Blackshire ICS Task Force Chair. So let me introduce this. So the Blackshire report exposes deep health inequalities affecting Black, African and Black Caribbean communities in Birmingham and Lewisham, driven by structural racism, poverty and social disadvantage. So combining research and lived experience, it identified 7 priorities for action, which include fairness, trust, better data and early intervention, health promotion and healthier behaviours, and health literacy. So with 39 practical recommendations, the review calls for culturally competent anti-racist systems that empower Black communities to lead lasting change and achieve equitable health outcomes. Right, with that being said, could you start by explaining your role of the Blackshire ICS Task Force and how it connects to the original aims of the Blackshire report?
Thank you, Rebecca. It was actually a mouthful to call Blackshire because it's Black, African, Caribbean. Well, as you said, 2 local authorities came together to look at the health inequalities in Black, African, Caribbean people in those cities. Lewisham and Birmingham. And this was on the back of structural racism. And I think COVID pushed this forward. So I came into the role as the chair about a year and a half now, and it's been in existence for about 3 years, as we heard from Helen Harrison earlier. My role is to facilitate to systemically lead colleagues, NHS colleagues, who come together to look at those 39 opportunities for action, but also based on those themes to draw up smart objectives that they can work on. And we can't do this on our own. We needed our deep engagement partners, of which you spoke to Tunde, who eloquently described his role. These deep engagement partners are equal partners with us. So, and they are the ones, the conduit between us and the community. So one of the ways to reach our communities is through the deep engagement partners.
Okay. So the Blackshire Review, or the Blackshire, should I say, highlighted deep structural inequalities and the role of racism, as you mentioned, in health outcomes. What have been the most significant steps taken since the report to begin addressing these issues across Birmingham and Lewisham?
I think I could list out a couple of key achievements. I mean, one of which, Olaunde Awe, Ilera Health, is one of them. They looked at immunization campaigns. They've gone to GP.
So what do you mean? So again, for someone who's listening and they hear immunization campaign, what do you mean?
Actually go to the communities and try and understand, why are we, Black African Caribbean, not engaging with vaccinations?
Right.
And then to hear from them what the issues are and use that as insight to deliver projects or interventions.
So important. As you're saying that, I'm thinking about, I remember during the pandemic, there were newspaper articles talking about, when the vaccine first came out, Black African Caribbean people need to have this first, they're high risk. And because people saw those headlines, there was a lot of fear, a lot of paranoia, a lot of, I'm not taking out, why, all of that sort of thing. So I can imagine, speaking to people like Ilera Health, obviously it goes back to what you're saying about trust. You're more likely to be honest about how you're feeling and also to be more receptive to the information you hear.
Absolutely. And I think one of the things, the insights they found was they were not getting the right information in the right languages, in the right places. So I think based on that, they deliver the languages in Pidgin English, in Yoruba languages, in languages that the people understand. And then, that worked.
Yeah. So the review placed strong emphasis on lived experience. How has the task force ensured that the voices of African and Black Caribbean communities remain central to shaping the policies and practice? I mean, I heard what you just said there about also making sure that language is accessible. Yeah. But what else?
The task force, we meet once every month, and it's an opportunity for NHS leaders who represent their organizations to come in a group meeting where the deep engagement partners, previously community engagement partners, meet. But then they have insights which we use. I'll give you an example. University Hospital Birmingham set one of their objectives to reduce DNAs, do not attend or missed appointments by 10% for Black African Caribbean people. They did that by 25%.
I'm confused. So sorry. Okay. So why?
It's difficult. I think one is the barriers could be language.
Okay.
The barriers could be the technology use. It could be that they don't even understand that they needed to attend the appointment.
Right.
And I think what they did was used one of the services, the diabetes service, where we have significant number of people who are Black African Caribbean suffer from diabetes. Yeah. And they achieved 25%.
Okay.
Which means improved the people who attend their appointments in hospital rather than not appoint, because as you know, these are expensive appointments.
Absolutely. So one of Blackshire's findings was the lack of meaningful data about Black communities. What progress has been made in improving how data is gathered and used to drive accountability and equitable outcomes?
This is a priority for all organizations. I'll start with the city council. When you fill in your ethnicity, it's either you're Black African. I think that doesn't identify where you come from. And Birmingham is a city where we've got Nigerians, Ghanaians, Eritreans, Somalians, and all that stuff. All these people are grouped as Black Africans,
Yeah.
you know, and they have their peculiar things that identifies them, you
Yeah.
know. So what the city council have done is to actually put their ethnicity, so we can then get granularity in terms of the
Yes.
data, and it helps. Solihull have changed their dashboard to ensure that ethnicity is a priority, but also the geography where they come from.
Yes.
Just recently, we went to the Royal Orthopaedic Hospital. They're doing great work in trying to ensure that we improve the people that attend the orthopedic hospital. Could you guess how many Black African people attend the Royal Orthopaedic Hospital?
No.
About 2%.
Wow.
Exactly.
Wow.
Yes. And we need to improve that.
Yeah.
So there's a lot of work we're doing with our engagement partners to try and understand why Black African people don't attend the Royal Orthopaedic Hospital.
Okay. Yeah, I can't even begin to. I'm thinking, could it be a perception thing? But yeah, that's what research is.
There could be a lot of reasons,
Yes.
but sometimes it's about finding out what the reasons
Of
are,
course.
which is what we're doing.
Yeah. Brilliant. Okay. Again, I have to keep this moving. What have been some of the toughest challenges in implementing the Blachier recommendations?
Capacity, capability. I think resource is one of them. I remember going to the local council and speaking to one of the councillors about funding. You know, one of the things we have is funding is not continuous. It's a stop and start. Helen Harris, who is one of our public health directors, know this. To make any change in terms of public health, you need almost 6 to 8 years to make a difference. We know that 4 times women die, Black African women die from maternal health problems. We also know that 8 times Black men and women are admitted through community treatment orders. So all of these things can only change if we continue to fund what we do.
Yeah.
Our community engagement partners or deeper engagement partners are commissioned for a period. What happens after that?
Yeah.
We also know with the priorities, you know, the NHS, although has a lot of funding, is also going through a lot of financial difficulties.
Yeah.
And one of the things that we know happens is health inequalities then becomes deprioritized.
Yeah.
However, you know, the 10-year plan, the 3 shifts, gives us that opportunity now.
Yes.
Because we can then talk about public health as something that needs to be funded.
Wow. You know, when I hear these statistics, I'm nodding and I'm like, yeah, I know it, but they're so wrong, you know? But anyway, my last question.
Okay.
How can health leaders cultivate cultural humility at scale, ensuring that it becomes a guiding principle in workforce development, service design, and leadership practice across the integrated care system?
I think it does it matter to them? I feel it matters. I feel as a health leader, I ensure that it matters to them. So I actually ensure that in our policies and procedures, cultural humility, intelligence, and safety framework is something that we talk. I mean, over 200 Birmingham City staff were trained, and we have almost 100 NHS staff being trained on cultural intelligence, and I think that's going, and it is becoming a bit more popular.
Yeah.
As you said earlier, it is something that is a subject now people feel comfortable listening to or engaging with. We feel that leaders should take responsibility. In our trust, our board sees this as something that is important and are driving it. And when you have leaders driving this, hopefully it's something that it will be picked up.
Hopefully. Yeah. Brilliant.
Yes, and I'm very hopeful.
Good. That's a really good sign. Thank you so much for the work that you're doing and for your time today. Thank you.
Cheers.